What if I told you that prostate cancer is diagnosed every 2 minutes in men around the world, and yet most men won't talk about it until it's too late? Despite being the second leading cause of cancer death among men, did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? That means in any group of fathers, brothers, sons, or friends, someone you know is likely to be affected. Prostate cancer still hides in the shadows of men's health discussions. Why is that? It's not because we lack the science. Today we have cutting-edge tools like PSA testing, MRI-guided biopsies, and even genetic screening to detect risk early. The problem is silence. The male culture of toughing it out or avoiding doctor visits creates a deadly gap between detection and action. In fact, some forms of prostate cancer are so slow growing that with early intervention, they can be monitored rather than aggressively treated, but only if they're found in time. Here's the real question. If men are living longer than ever, why aren't they living healthier? The answer lies not just in biology, but in behavior. Studies show that men are far less likely than women to seek preventive care, and prostate health is one of the biggest casualties of that reluctance. The irony? Prostate cancer caught early has a nearly 100% 5-year survival rate. That means lives are being lost not because we can't treat it, but because we're not talking about it. In this video, we're breaking down the science, busting the myths, and challenging the stigma around men's health, one truth at a time. Because the first step to saving lives is starting the conversation. Prostate cancer, it's one of the most common cancers in men, yet it's also one of the most misunderstood and dangerously overlooked. Why? Because its symptoms are often subtle, easily mistaken for normal aging or ignored altogether. Frequent urination, difficulty starting or stopping, or even lower back pain might not raise alarms, but they should. Unlike some cancers that shout, prostate cancer often whispers, and by the time it speaks loudly, it may have already spread. That's why awareness and early detection aren't just helpful, they're critical. In this video, we're diving into the science behind prostate cancer, breaking down the early warning signs you should never ignore, and showing you why getting tested could mean the difference between life and death. Whether you're over 40, have a family history, or simply want to take control of your health, now is the time to learn, act, and start the conversation. Stay tuned till the end, where we'll share the gripping story of a prostate cancer patient, one that's both eye-opening and deeply urgent. It's a real-life journey that reveals just how dangerous this disease can be when left unchecked. You won't want to miss the lessons hidden in their experience. This story could change the way you see your health forever. One of the biggest myths about prostate cancer is that it's a disease only older men need to worry about, but that's far from the truth. While the risk does increase with age, men as young as their 40s have been diagnosed, especially those with a family history or certain genetic mutations like BRCA1 or BRCA2. The real danger? Far too many men brush off early symptoms as just getting older. Trouble urinating, pelvic discomfort, or even erectile dysfunction are often chalked up to stress, diet, or aging and never get checked out. This silent denial creates a ticking time bomb. Prostate cancer in its early stages is highly treatable, sometimes even manageable without aggressive treatment. But when ignored, it can spread to the bones, lymph nodes, and beyond, becoming far more dangerous. Compounding the issue is the fact that men, on average, are much less likely than women to seek medical advice or undergo preventive screenings. That hesitation, combined with misinformation, leads to thousands of avoidable deaths each year. It's not just a medical issue, it's a cultural one. Breaking the silence around prostate health isn't just about spreading awareness, it's about changing the way men think about their bodies, their health, and their future. Here are 8 sneaky signs of prostate cancer, each one subtle, easy to dismiss, but potentially life-saving if caught early. Understanding these signs can empower you or a loved one to take action before it's too late. 1. Frequent urination, especially at night. Waking up multiple times to urinate might seem like a normal part of aging, but it can be an early red flag. An enlarged or cancerous prostate can press on the urethra, disrupting normal urine flow and bladder control. Second difficulty, starting or stopping urine flow. If it takes extra effort to begin urinating or if the stream feels weak or interrupted, pay attention. This can be caused by a tumor pressing against the urethra or blocking part of the urinary tract. Third, pain or burning sensation during urination or ejaculation. This isn't just uncomfortable. It could be a sign of inflammation caused by cancer or related conditions like prostatitis. Many dismiss this as a urinary tract infection or irritation, but persistent pain deserves immediate medical attention. 4. Blood in urine or semen. Any trace of blood in urine or semen, no matter how small, is a serious signal. While it could indicate other conditions, it's a known symptom of advanced prostate issues, including cancer that's beginning to spread or cause internal damage. 5. Erectile dysfunction or difficulty maintaining an erection. While common with age, sudden or unexplained erectile issues may stem from prostate problems. Tumors can interfere with nerve signals or blood flow necessary for a normal erection, making this a symptom that should never be ignored. 6. Persistent pain in the lower back, hips, or thighs. Prostate cancer that spreads often targets bones in the lower body. If you're experiencing consistent, dull aches in these areas, especially if they don't respond to typical treatments, this could be a warning sign of metastasis. 7. A feeling that the bladder is never fully empty. Even after going to the bathroom, do you feel like something is still left behind? This sensation often comes from a prostate growth pressing on the bladder, limiting its ability to fully empty and increasing the urge to urinate. 8. Unexplained weight loss and fatigue. Sudden weight loss or constant tiredness without changes in diet or activity can be an indication that cancer is affecting your body's metabolism. When combined with urinary symptoms, these signs should raise serious concern. Each of these symptoms on its own might not scream cancer, and that's exactly why prostate cancer can go undetected for so long. But together, they paint a picture the body is trying to show. If any of these feel familiar to you or someone you love, don't wait. Talk to a healthcare provider. Early detection isn't just better treatment, it's better chances at life. Let me tell you about Marcus, a 48-year-old gym coach who prided himself on his health and never skipped a workout, but he did skip doctor visits. He brushed off his frequent urination, blaming it on increased water intake, and ignored back pain, thinking it was from lifting weights. Months passed, symptoms worsened, and finally, at his wife's urging, he got checked. The diagnosis, stage 4 prostate cancer, already spread to his spine. He was shocked. He looked and felt fit, yet cancer had been silently growing for years. Marcus now shares his story publicly, urging men not to confuse fitness with immunity. His biggest regret? Not listening to the subtle signals his body was giving him. His experience is a powerful wake-up call. Being strong doesn't mean being invincible. Early detection is the real strength. If this video resonated with you, like, share, and subscribe. Your support helps spread life-saving awareness. Drop a comment below if you or someone you know has faced these symptoms. Share this with the men in your life. One click could make a difference.